So good to be with you all on this crisp Valentine's morning here in Peoria. Let me take my mask off. Here in Peoria. Over this last couple of years, we've had some significant challenges, not just here in Peoria, but across the country, as it relates to collaboration, as it relates to public safety, as it relates to mental health. And I could not be more proud to stand here today with this collaborative team who has come together to bring forth something that Peoria has never seen before, that is incredibly innovative, that is really about centering public safety for all of the citizens and our neighbors here in Peoria, but also for the public safety of our officers that are sworn to protect and serve and work every single day to put the best interests of our public safety first and foremost. So I'm excited to be here today because this bill, House Bill 5319, which is the Police Plus Mental Health Emergency Response Pilot. This pilot was born out of collaboration with the Peoria Police Department. In particular, Chief Echeverria has, as you all know, he has come to Peoria and absolutely hit the ground running. This initiative would not be possible without his leadership, and I'd like to say thank you to him. I reached out to Chief and I asked him, I said, listen, we want to make sure that we're doing everything that we can to work closely with law enforcement so that we're ensuring that we are centering people in this public safety strategy, and we can't have strong public safety without the support and collaboration of law enforcement. Are there any ideas that you have? And she said, oh yeah, I got a couple. And he shared those ideas with me, and I love them. And I think that this is the kind of work that you get in a community when you have a phenomenal behavioral health, mental health leader like Unity Place. I'll allow him to really talk about the program and the connection and collaboration that has been fostered between the Peoria Police Department and the Unitypoint, Unity Place effort, and the work that they've been doing for as long as I'm a daughter of Peoria, so for as long as I can remember, Unitypoint, Unity Place has been the behavioral health, mental health leader in this community. And so what you're going to see here today is not just something that we're going to be doing in Peoria, but Peoria is going to be a leader as it relates to communities that are not working with this approach, because you'll hear from Chief Echeverria that there are other communities that are doing things in this way, but there are a lot of communities that aren't. And so I'm excited to be here today with these phenomenal leaders to bring forth this concept that will be in a House of Representatives committee later on this week. So with no further ado, the man of the hour, Chief Echeverria.
Thank you. First of all, I got to say thank you for being here. Thank you for this opportunity. We're very excited at the Peoria Police Department to really collaborate with Unity Place, Unitypoint, obviously the state rep who's helping push this through. We have a great team at the Peoria Police Department, and thank you for the acknowledgement, but we can't do this without the great team that's at the police department as well, to really push these kind of initiatives through and have the collaboration that we're going to have and continue to have with our community stakeholders. When we think of mental health and behavioral health, we have to be able to start looking at things a little bit differently, looking at it through a different lens, and understanding that we have to deal with things a little bit differently. And that's what we want to do at the Peoria Police Department. I said this earlier to somebody else, is when a flower doesn't bloom, you don't fix the flower, you don't remove the flower, you fix the environment around it, and that's what we want to do. We want to be able to fix the environment that we have as we deal with mental health and behavioral health, really reducing the volume of calls that we'll have to respond to, the use of force, and the recidivism that we see with some of this. Again, very excited. Thank you. This is a new idea for me. In Elgin, Illinois, where I came from, we had something very similar to this. We're going to create a different model here where we want to have in our juvenile division, social workers, in our adult investigation, social workers, to really follow up on these cases, some case management, along with Unitypoint, Unity Place. I'm excited, the staff at the police department is excited, and we're looking forward to this collaboration. So thank you. pass it off.
Good morning, everyone. I'm Keith Knepp. I'm the Regional President and CEO for Unitypoint Health, and I'm going to turn the mic over to someone else in just a moment. But let me say I'm so grateful for the leadership of Representative Gordon Booth and her support in this initiative, and I'm tremendously excited for the vision that Chief Echevarria is bringing. When we first heard about this possibility, we immediately saw the opportunities to reach out differently and support the people in our community that were in need and how we could do this together. So I'd like to introduce Mary Sparks Thompson. Mary is the new president of Unitypoint. She's been with us for just 2 weeks, but she brings tremendous experience to this space, including some experience in co-response models in the past. So I asked her to just talk a little bit about, what are the key points of what we're talking about here. So Mary, thank you.
Thank you. Good morning, all. Well, our vision at Unitypoint Health, Unitypoint, is to increase access to behavioral health services for our community and substance abuse disorder services. And we see this co-responder model where we would have law enforcement along with behavioral health experts responding to calls involving behavioral health needs as a way to really extend that reach further into the community. This is an innovative, collaborative model that we really look forward to partnering with all the key stakeholders here to improve access and to better support our community with behavioral health crises. So thank you very much.
We are available for any questions at this time.
Sure. So I guess, would you be able to just kind of drill down on that co-responder team a little more specifically? Say, so if there's a call that's made, who's showing up at that time?
So for us at the police department, we have our SRT team who handles most of our high-profile calls, if you will. If we have a person that is an emotionally distressed person and we need to respond to that, they may be suicidal, they're barricaded in their home. We would have two of our SRT officers who we envision to be driving around the streets of Peoria along with our mental health workers and our partners from Unitypoint and Unitypoint in responding to those calls. So we're not looking at having our regular patrol officers responding. We have our officers who have the skills, the talents, they have the training in crisis intervention, de-escalation, and using the appropriate tools. The objective is to really de-escalate the situation, have somebody on hand who can do an evaluation, and possibly have the involuntary committal done from there and skip the ER visit and come right to Unitypoint.
So social workers not going to just go there by themselves. I know recently there was a DCFS worker that was killed down in central Illinois. So there's like guardrails in place, like something like that doesn't happen.
Exactly. And we've heard the conversation over the last few years is there's things that people don't want to see the police doing, but we don't have the luxury to say no, so we want to be able to do this effectively and efficiently and safely. And the social workers don't want to respond, or the mental health workers don't want to respond by themselves either. So we want to create this model where we're there working together collaboratively.
Sure, and you mentioned you had already done something in Elgin? Is that
Correct, Elgin, Illinois.
Yeah. Can you describe what that looked like, and then how, you said it's going to be a little bit different here, it's a larger city, how will that be different?
Well, it's different because there's different resources in place. There's different needs that we have here. We're not going to see the same thing from city to city, so you have to evaluate what's going on in our own city to figure out what we need to implement. But Peoria is full of services. We just need to be able to funnel those services together and collaboratively work together to get the services in the right place at the right time. And I think that's what we're looking at doing. The difference here would be we want to put social workers in our juvenile division as well with this program, who will follow up on their juvenile cases and be able to touch on all those cases. So we get a first-time offender, a second-time offender, a juvenile that just came in. We want to be able to follow up because we don't want to see that juvenile again, and we want to be able to provide services for the family that we may not know are needed.
Chief, what are you going to be looking for early in the deployment of this program to kind of tell you what's working and maybe what isn't working as you guys kind of, introduce this to Peoria?
Yeah, what we'll see is our calls for service. Right? We know that we have over 600 calls for service that are categorized as mental health calls. Well, we have officers that are responding to that who are on patrol. What we want to see is we want to be able to take those off their plate because we want our officers to be proactively working to make Peoria safer. If they don't have time to do that, they're just going from call to call to call. Well, we'll be able to see how much more productive time, proactive time we'll have, and we'll know the amount of calls that our emergency response team will be able to respond to, and we'll have those numbers.
Can you speak a bit more to that 600 calls for service? Put that in context. Of all the calls that you get, how many do end up categorized as mental health calls? Did you see that increase during the pandemic?
Well, I wasn't here during the pandemic, so I can't give you that number. I know that when I had the numbers pulled, and those numbers aren't going to be accurate because the way it's done now, there's some calls that ERS responds to, there's some that we respond to, and the way it's done now, it's not exactly correct. The numbers aren't. So we want to be able to fine tune that and really know that in Peoria, these are the numbers we're responding to. So we believe the numbers are even higher than that.
Okay. Can you speak just kind of generally ballpark of all the 911 calls you get in a day, how many do you respond to where you're like, man, we really could have used a social worker in this spot?
There's quite a bit of calls. I mean, over the weekend and last week, we've had quite a bit of calls and scenarios where we would love to have a social worker out. And I think every domestic violence call that we have, we want to have a social worker be able to touch that. What we miss in policing is the victims. Right? We're in a hurry to make the arrest. We want to make the arrest. We want to close up that case. But there's victims that are left behind that need some case management, some extra help. The same thing with any juvenile arrest or any juvenile case that we have, we want to be able to touch those as well. So I can't give you an exact number, but I'd love to touch all cases that come through with some case manager and some follow-up.
A question for, I think either Keith or Mary, whoever wants to take it. Does Unitypoint already have the staff on hand to deploy this program, or do you guys have to do more hiring? Did you already do more hiring to get this going?
Yes, we would want to add some additional staff to ensure that we have proper support for this program.
Do you know how many staff you're looking to add?
Not yet, not yet.
Chief, what would the timeline look like for this? I saw in the release it would be about 6 months post-passing, but how long would it take to train officers as well as implementation citywide?
Well, we have to look now and see. Our SRT team is very well skilled and trained. There's some other trainings that we want to make sure are in place. One of them is through New York, to the Emergency Services Unit, who does this same exact thing in a much bigger scale. We want to be able to get all our SRT officers at some point through that training. And we want to make sure that everybody is trained in crisis intervention. And then there's some tactics that we need to, other tactics that we want to train in. But we also got to make sure we have the proper equipment, uniforms, vehicles that are going to be needed, specialty vehicles that may be needed to deploy on the street.
Will all that equipment be funded through this bill as well?
Well, and that's the hope that we can do that, yes. But I guess I would let the state rep answer that one for us.
So the beauty of, of a good idea is that they spread, and they spread quickly. And so what I've seen since the introduction of this bill a few weeks ago is interest around the state. Folks, many communities, law enforcement, different state reps, state senators, wanting to do something very similar to what the chief is going to be leading here in conjunction with Unity Place in their own communities. So right now, we don't have a dollar figure on what this will cost, because obviously if we were just talking about, doing this just for Peoria alone, it would be, the number would be easier to come by, but the number would also be smaller. The fact that we're talking about doing something that could span, a good portion of this state means that it's going to take more time to be able to come up with a final number. But certainly we'll know what that is within the next few weeks.
Sure, and piggybacking off that, actually, I know in Pritzker's Day of the State address, he had a lot of behavioral health and whatnot, including establishing a chief behavioral officer. Will that person be involved in this at all? Like, is that how
I won't say yes or no, because I don't know the answer to that question. Because again, this was really born out of an organic relationship right here in Peoria. But certainly, if they want to be involved in what it means to really begin to give resources to the issue of public safety in the way that we need to, this is a very real thing. For many years, as folks that are in this room who are engaged in this space, they know that, state budgets were constrained for a number of years, and a lot of things were allowed to get out of control. And so what we are experiencing right now, frankly, is a result of some of these festering issues and the lack of the proper investment being done in a very targeted and in a very intentional way, so that we're actually investing and we're actually getting significant return on that investment. And so certainly we'd be more than happy to welcome the governor's chief behavioral health officer.
Yes.
I think that's the name of it.
I think it's a mouthful.
He'll be here. He'll be here tomorrow, so we can ask him tomorrow if they're going to be involved.
Very good. And then I guess, in a way, like, once you put this program in place, how will you know if you've succeeded? Like, what will that look like?
Yes. For us, is people not committing violence, for one. For two, people getting the help that they need. Right? We cannot arrest our way out of situations that we see ourselves in now. We see things that are happening. If the only tool we have is to arrest, that's all we're going to use. So we have to have other tools in place. And with these tools, we'll be able to see people getting the help that they need, the reduced juveniles coming into the system, the victims getting the assistance that they need, and I think that's going to be the measure for success for us.
And with Unity Place, how does that make, I guess, perhaps Peoria a great spot to start a pilot program because of the resources that we have today?
Could you restate that
I guess,
question?
like, what makes Peoria a good place to put a pilot program with respect to having some places like Unity Place?
That's probably
Okay.
better for you.
I would say first and foremost, we live here. This community is incredibly important to us. One might even say for selfish reasons. But the fact is that Unity Place is a behavioral health and mental health leader in this region. And I don't think that can be overstated enough because of the key role that they have for decades played in this space. We're very blessed to have them operating in this capacity and going to be working so close with the Peoria Police Department to ensure that, this opportunity, this initiative is successful. What I would also add is, I think the question that you had right before this one was, how do we determine success? I think that success is going to be viewed differently by different groups, right? So the way that Unitypoint, Unity Place would look at success may be different from the way that the police department views success, which could be different than the way that the Illinois General Assembly views success. But as the lead sponsor of this bill, one of the things that I stated earlier that's so critically important is a very people-centered approach. And that is what has been laid out here. It's a very people-centered approach that allows for us, again, to really put the public back into safety, because this is about everybody. This is about the safety of our neighbors and our citizens. This is also about the safety of our officers. And so for me, when I think about what does success mean, it's being able to identify those folks that were helped by this program, because oftentimes it takes years to begin to see a real movement in numbers in any kind of program or initiative. Obviously, you don't want to be in the situation that we are in currently for years and years. But the voices of those victims who are supported by this initiative are the things that I know will weigh on me the most and will keep me continuing to fight for this year over year.
I would add to that, that we should think not just about the moment. Oh, sure. I think we should think about this pilot not just about the moment when the co-response happens, in the moment when someone's in crisis. What happens after that? And that's where the resources of the community can come into bear, whether that's medical, whether it's United Way's 211, whether it's the resources of Unity Place. And so even the place we're standing in here, there's detox opportunity, there's this living room space for peer counseling, there's the follow-up counseling, other services that can be provided. And so, one of the things that's important to us in this message too is that we're worried about linking the perception of violence and mental health together, right? Because a lot of violence occurs outside of the setting of mental health. And a lot of the mental health needs that come from violence come because of the impact on the people who are affected by the violence, right? Whether they're in an abuse situation or whether they become a victim or they lose a family member. And those people don't always know how to tap into resources. So when I think about how this, how do we measure success, it's both in statistics and it's in stories. And the statistics are going to be who all comes to see us that didn't see us before. But when we hear the stories of the people that are impacted, then we know we're making a difference too. So we need to look for both of those.
Jahan, some of the recent crime and policing bills that have moved through Illinois have been contentious, I guess, between the two sides of the aisle. Have you found this bill to be easier to move, or are you expected to have kind of a fight getting this one passed as well?
I don't know. This bill's going to be up on February 17 in the Fire and Police Committee at 8 a.m. We'll have a much greater indication as to what that'll be like at that time. But I think that what you see here today is a collaborative effort of two very critical institutions right here in our community. But just from an anecdotal way, the response that I've gotten from folks around the entire state who see what we're trying to do here in Peoria that would actually like to replicate the exact same thing in their own community, I think that that's a pretty good indicator that we're going to have a strong shot in committee this week.
How long has this bill been in the works?
Not long. It's moving very, very fast. A month, if that?
Yeah, probably maybe two.
Yeah,
Maybe like right before Christmas.
Yes, yeah. It's
So-
moving quick.
It has been quick.
Yeah, I'm wondering if there's any overlap here with this bill and the violence intervention money that Governor Pritzker appropriated over the next 3 years. Did this idea come out of that big town hall we had at the church a couple months ago?
No, we were talking about this before that happened, but I think for us as a community of folks that forget our titles and forget the roles that we play, but just as people that love and live in this community, it's important for us to remember that as it relates to something as important as public safety, everything matters, right? Having the ability to have resources to invest in communities in things like trauma supportive services, after school programming, making sure that young people have opportunities to have quality work opportunities at an early age, 15, 16 years old, in a path potentially that could lead to an internship later on in their life. Those things are very important for like the foundation and the fabric of a community. But then also, and that's like the Reimagine program, some of the violence intervention programming that's going to come out of that, the after school programming, those kinds of things. But then you have opportunities like this that also require funding, but it also requires a collaborative approach. In my estimation, all of these things are public safety. Public safety is about people who live in a community feeling safe and secure and feeling like there's opportunity in that community. And so I don't want to say that it was a part of that, but for me, when I think about strong communities, everything works together and nothing is in isolation.
And I'm thinking about some similar ordinances that have gone through Chicago City Council and a lot of the contentious nature of those. I'm not completely up to date on this, but back when I was there and I was covering it, a lot of those ordinances relied on taking funding away from police department budgets and reappropriating it. This seems to be different in that you're not taking funding away from anyone, you're asking for more funding to create something new. Is that accurate, and do you think that that kind of approach might lend this to not be as contentious as what's being proposed in Chicago?
So I would say that, what is it that, I think it was Abe Lincoln, President Lincoln, who, wow, that was very casual. President Lincoln said, when you have public sentiment, you can do anything. And when you don't have it, you can do nothing. The public sentiment around ensuring that our communities are safe, that we have a much more coordinated response to mental and behavioral health is something that I think is widely understood by most citizens. Ensuring that we are supporting our police officers to do the work that they do. Again, all of these things are things that are, I believe, pretty much universally known. And so with that being at our backs, I believe that that creates an opportunity to be able to move forceful, to get the resources that are needed in this space. Sometimes, you know, here's the reality as it relates to like budgets. You can go after, say, a controversial item and pretty much ensure the demise of whatever initiative that you want to work on or to move forward. But I think that the more logical, the more practical thing to do in this moment is to find the things that maybe aren't working in the way that we would like them to work, because clearly we know that there's always going to be ways for us to do things better. And so in my estimation in this moment, that's where we're going to get these resources from. We're going to find those things that may not have worked in the way that we wanted them to work and move them towards an initiative that we know that we have a lot of belief around, and that frankly the public sentiment, I believe, would be supportive of an initiative like this. So we'll find the money, basically is what I'm saying.
I feel like a lot of our listeners might be curious about this, and if you don't have an answer, understand, but there are some plans to merge with Carl in the Peoria area in the near future. How would that affect or not affect what's going on here?
Yeah, it's a great question. The question was how might Carl impact this plan or maybe behavioral health in general? The local organization will stay intact as we move into Carl if that happens, which means our initiatives stay intact, and our commitment to behavioral health won't waver. And I'm very confident from our conversations with Carl that they'll be very supportive of that work.
All right, thank you guys.
Thank you.
Thank you. Appreciate you.
Yeah, you too.
Thank you so much.
I want to give you my cell.